Good morning. It's Saturday morning. I know you're bright and awake and ready to go, and we have some fantastic moments ahead of us. Welcome back to ChiroThon Day 2. We have an amazing lineup ahead of us today, and if you'd like to see the full schedule, it's very simple. You can view any of the missed vignettes from yesterday, and you can look ahead to see what the future has in store for you this morning.
You know, I had so many people that told me yesterday how much they appreciate the fact that we're uploading some of the segments that they miss. So I just want to make sure that you understand that we have you in mind, because we don't want you to miss any of the information that we're bringing to you. All of these amazing speakers and guests that we're bringing to you that are sharing and celebrating the benefit of chiropractic and the benefit of living a lifestyle that is full of wellness. So we're kicking off this segment with something that I'm very excited about, and that is the relationship between chiropractic care and yoga. And this segment would not be available without the support of ChiroHealthUSA. Now, most of you may not know, but ChiroHealthUSA has over 1.3 million families across America being able to have affordable health care through them, and more than 7,500 member doctors that are practicing with a peace of mind to make sure that they are charging properly within those states. So if you want more information about ChiroHealthUSA, go to www.chirohealthusa.com/RAS. Now, in less than 5 minutes, you can answer 8 simple questions to find out exactly which aspects of your financial policies may be inadvertently exposed to potential complaints, audits, fines, and penalties. This is something that I'm very excited about because it keeps you not only compliant, but it keeps you ethical in the eyes of the healthcare world.
And we know so many of you out there are treating fabulous patients, and we know there are patients out there watching. So we are so excited to be able to now move into this segment, which is with Dr. Heidi Crocker. Dr. Heidi has been involved in chiropractic for many years. She's owned integrated wellness centers, and she focuses on family chiropractic and yoga therapy. This is one of the reasons why we brought her, because she is an educator. She is all about promoting the education and well-being of her community and making sure that she advocates for training with healthcare providers in the mind-body technique for their self-care and integrating these into complementary tools for patient care. This is one of the pieces that I think you're really going to enjoy, because not only is she part of chiropractic, but she's also part of the International Association of Yoga Therapists. And as the director, she is really working hard to build the awareness of what that synergy is between chiropractic care and yoga therapy. And she practices at Mama's Chiropractic in Huntington Beach. So she's a local, she's very close. We love that she's very close. She's specializing in prenatal, postnatal, and children. So we want to thank you for being here today. Welcome to ChiroThon.
For having me.
It's very exciting. Well, we don't want to waste any time because we have a lot to get to. But one of the things that many people ask when we are on the road is, how does chiropractic and yoga therapy synergize together? What are some of the things that align with that whole being approach?
Mm-hmm. Well, you know, being in chiropractic for over 30 years and all of the practitioners out there, we know that chiropractic addresses spinal and neurological health, right? And which is the foundation of our being. And the synergy with yoga is that yoga also, through movement, through breath work, through mindfulness and meditation, also regulate that nervous system. So what we do in the office, what we do with our hands, our healing hands, yoga gives the patient, the client, the person autonomy to do and take care of themselves on their own. Where yoga therapy comes in is that many people don't know what to do. They don't know how, you know, they get on their little mat and they just, I don't know what to do. So yoga therapy is a bridge between the clinical setting, chiropractic setting, yoga therapist will create a practice for someone, whether it's 3 minutes, 5 minutes, 10 minutes, and then they can take that home and do that for themselves and take care of themselves.
You know, I was so excited when yoga came into the picture. They did something really well, and that is they market themselves to be very appealing to the masses. And even though chiropractic have been around for so many years, we have not done such a good job. But then the more that we as chiropractors that were practicing yoga began to share that with our patients, there was a tremendous sense of alignment. But lately, especially in this political climate, we're talking a lot about chronic illnesses. As you know, it's one of the largest numbers that we've ever seen in history. We're concerned because now that's impacting our children, which have one of the highest numbers of chronic illnesses today. So when you think about synergy of yoga, chiropractic, how does that relate to many of the chronic patients that we're having? And what should we be thinking as chiropractors to maybe consider yoga as part of that process?
Yes. That's come, that experiential learning of actually practicing yoga and then realizing what it does for you, and then how you can take that for your own self-care and burnout and all the things that we're experiencing as practitioners, but then how that you can take that into your practice, into your patients. And we are all very aware of the opioid epidemic that we're still experiencing, and some of the chronic stresses that our younger folks are seeing. And I was actually working as a yoga therapist in a integrative health center at a major university in my area. And the patients or the clients that the practitioners were sending me were many of those that had chronic illnesses that were trying to figure out how to live in their new normal. And they were many times, all the autoimmune conditions, for example. They can't even get up and down off the couch. And within a short amount of time, being able to work with them and help them know where their body is in space, they're now up and moving again. So I think it's a beautiful synergy that we as the chiropractor can put our hands on them and say, your nervous system you are aligned, you're ready to go. And right here in the office, right, we can do some therapeutic activity and get you healthy in your movement, your breath, and mindfulness.
Wow.
Yeah.
That's outstanding. You know, many of you watching have a chronic condition, and we understand. In fact, 96% of all prescriptions that are made in the United States right now are made for chronic conditions. 6 out of 10 adults are suffering with a chronic condition. So no matter where on the spectrum you are, chronic pain, currently healthy, strong, and vibrant, and you want to keep that and optimize it, or you also want to prevent further injury in your life, so your longevity is good. Because yesterday, I know you were watching, we had Kurti Kulsa with the Alzheimer's Research and Prevention Foundation, and it fits so beautifully with the yoga. And as we talk about chronic pain and we talk about our longevity and how do we spice our life back up, this is one beautiful way, is being in the yoga mindfulness, the spiritual portion of it, and the connection. And you noted something very important, which was the nervous system. Yeah. And so for those out there, we're not going to go deep in it, but we have some fantastic guests coming on that I know you're going to love. But what I want to bring up is on a very 60,000 foot level for the Saturday morning gurus out there. Can you talk a little bit about the nervous system and how does that impact both with chiropractic and with yoga?
Yeah. Well, I mean, it's becoming more mainstream now to talk about deregulation of the nervous system and how to regulate the nervous system. And chiropractic does that so beautifully. I mean, I've been working with a lot of babies. You put your hands on a baby and you touch them in the right place and you can just feel them melt. And in adults the same way. Chronic stresses, that parasympathetic fight or flight and freeze mentality that many of us have. And we put our hands on them, we get the nervous system flowing, And then yoga therapy, again, mainly through the breath work, through the mindfulness, and you bring up a really good point through the spirituality. And that is like, what is my purpose? What is my purpose in this world? How should I be? What is my purpose? And to sit quietly, to have your body go through movement and your breath to soften that nervous system so that you can sit quietly. That's what it's about. You move, you breathe so that you can be still. And then enlightenment comes. And that enlightenment is, what is your purpose?
You know, it's interesting. When I first started this process, I realized I was an athlete in high school and college, and I realized that my biggest issue was I was trying to find a way to increase my flexibility, maybe the function of my body. You know, chiropractic introduced me to the importance of getting aligned in your spine and the importance of that nervous system. But then we look at our lifestyle. And in those days, you know, you go to the gym and you work out or you play a sport. But then when yoga came into the picture that we started seeing popping everywhere, I realized that it was a place to reset.
Yeah.
But how does that relate to the fact that many of our patients are struggling with very rigid muscles, very rigid ligaments, their mobility because of the lack of activity in their lives, because they're not moving properly, because of the lack of hydration, all of the things we've been talking about all weekend. How do you feel yoga can really support those chiropractic patients when it comes to their function and mobility?
Yeah, well, if I can speak personally from my practice, is that I use yoga, I teach yoga in my office to watch and observe the function of the body. And then I can determine, it makes me a better clinician, because I can see how not what they feel like static on my table, but actually watching them through motion. You know, we've done gait analysis, we do all the things, but to actually watch, just observe them moving in their body is pretty powerful. And you bring up athletes. I mean, it is, you know, athletes, but also you can take that same concept to people who have a job where they sit all day. They're in one motion all day long, and they're doing the same thing, repetitive motion. And how that impacts their body, they almost, that connection, nerve connection gets lost to the opposite motions so that they can stay balanced. So where yoga comes in, and you know, yoga has been commercialized quite a bit when we think, we have to be doing the downward dog and we do all the power vinyasa and we do this, and that is absolutely.
And don't forget the shopping of the dressing, because some of these outfits are getting fancy.
I didn't wear my scarf today or my beads. I'm so sorry, but I you know, I want it to look normal because normal people can do yoga. And there's so many levels of it. But really what you are doing is, it is a one activity where you're using the strength, the flexibility, and the stability of all the structures of the body. And so I love that. It's a reset. And even, you know, patients say, well, I don't have enough time. I can't do yoga every day or 3 days a week. Well, you got 5 minutes in the morning to reset, or maybe once a week you take 30 minutes. And that, I love that word. It's a reset. You can close your eyes and say, how do I feel inside my four walls? Like Sid Ziglar used to,
it's your time.
Up, down, and down, and up, and in and out.
No, it's true.
That's actually, Heidi, it was really beautiful that you brought that up, because Heidi and I were at a conference with the International Association of Yoga Therapists. So hi, everybody out there who's from there. But we met with someone who is just really a beautiful person, upside down, inside out. And her name is Susie McCormack, and she did a book called Genius Breaks. You can watch that segment on Adjusted Reality, but it was during the day, how do you bring yoga into your everyday lifestyle? So I really like that you're bringing it to life for everybody, not just the people that are going to get into their yoga outfits and get into it, but yoga is a part of every day, and it really does help stabilize.
Well, and one of the things also, because you're a chiropractor and you've been in this other space, what would you recommend to us to do? So let's say that many of the people that may be watching us right now have never really tried yoga. Or maybe they tried it because they were traveling somewhere and they happened to be a yoga class, but they never practiced it on a regular basis. What's the, in your opinion, the best way we can incorporate yoga into our personal lives? And then how do we then share that with our patients?
Yeah. I think that bridge of yoga therapy, which is a there is a certification for a yoga therapist. It's a CIAYT. They just incorporated an exam to become. You have to take a training,
Oh, wow.
800 hours of training. You take an exam, you get your certification,
That's-
and their specialization is to work in the wellness and healthcare space. To be that bridge.
Okay.
So I think that having a yoga therapist in your office or working together with you,
Yeah.
that you work synergistically with that patient-centered care, whole person care, working together. You see what happens. You watch it, and it will bleed onto you of wow, I'm seeing these transformations in my patients. Personally, how do you bring it into your world? 5 minutes. 5 minutes a day of just starting that reset. Somebody asked me one day, we were having a conversation about routines and repetition and how you start your morning. And is that yoga?
Yeah.
And somebody said that, well, having a cup of coffee every morning at 9 a.m., that's not yoga. And I said, it isn't? Really? It's not? That you have your routine of making your coffee.
Yeah.
It's the same time every day. It's your quiet time. This is what you do. It's your centering.
A ritual kind of
your
thing.
ritual.
Yeah.
Then it is yoga. That's yoga.
That's beautiful.
So, and just bringing it into those little things, how you interact with the patient, the compassion, the empathy you have, that's yoga.
I think as a parent, how cool would it be just to do a yoga class with your kids? Just to
100%.
bonding time.
Yeah.
It's healthy and all that, but when you're seeing chiropractors out there, would you suggest, let's say they partner with a yoga instructor that is certified, do they bring him in after hours to do yoga classes in that office, or is it something that, let's say I don't have space to add another room where we have a yoga class throughout the day? How would you incorporate yoga on a practical basis in a practice?
Yes, well, I've done that for
Yeah,
many
I
years,
know.
and it started with just having back care classes.
Oh, I love that.
And I was always a little uncomfortable having a back care class as a requirement for new patients, and then just lecturing with the spine.
PowerPoint.
You'd
Oh,
stand
yeah,
with
yeah.
the spine, and you talk to them. So I started doing movement classes, and it was back care class, and all new patients had 6 classes that they had to take, and that was my observation time. And there would maybe be 3 people, 5 people, and I could say, this pose is something for you. This is for you.
Interesting.
You need to pay attention to this. That grew into a yoga studio in addition to my office.
Within your practice,
Yes,
or
yes.
outside or next to it?
Upstairs.
Wow.
So I would put on the chiropractic hat and the yoga hat. But what patients, and many people that took yoga there were not patients, and many patients did not do yoga.
Yeah.
But what ended up over time happening is those that practiced yoga would say, I was practicing today and I couldn't do this.
Interesting.
And can you check my spine? I feel off. So there's so many ways to integrate it into your practice, but you can do one-on-one. Have a yoga person there a few days a week that spends 30 minutes with the patients. Sam Collins was just talking about the therapeutic activity versus therapeutic exercise.
Yeah.
That activity therapeutically in your office is very valuable.
Yes.
And I think as you're listening today and you're thinking about your own health and your own rituals, one of the things that I found really rewarding is starting to grasp what the yoga therapist is looking and watching for. My mobility, my stability, my flexibility. but then starting to get into some of the poses that I couldn't get in before, that I didn't even realize I was that tight as a runner. I recognized there was areas of my body that they don't want to participate, but then all of a sudden I was able to draw deeper into the pose, and my body felt stronger. Talk to me about when you first started yoga. What did you notice, and why did that drive you to keep pushing that envelope?
You talk about running. I was a triathlete, and somebody said you should try yoga. So I would run to the yoga class and always and get there late, so I didn't have to do the centering at the beginning.
Wow.
And then run home. But I had to leave early before the Shavasana, so it wouldn't be dark when I got home. So it was very much the physical component to it. But then when I really started seeing the synergy of the practice, chiropractic practice, and I was starting to do yoga on my own, I started to notice expressions on people's faces when they were moving, or when I would touch them, of fear of pain, and reactionary movements of their body, which is above and beyond just the flexibility and stability, right? That's the mindset, that's the mindfulness, and to know that they are okay. You are okay. If, try it. I'm working with somebody right now who has all kinds of comorbidities, autoimmune, and when I first started working with her 4 years ago, she could barely sit in a seat and move her arms. And now she can do downward facing dog and warrior pose, but she's so dependent on me standing there with her. She's not there yet. I have to say, it's okay. You can do this. She can't do it at home yet by herself, but she can do it. The transformation has been phenomenal because her confidence, her self-confidence, her ability in her own body. And that's not just the physical.
Right.
That's what chiropractic does, right? If you are out of alignment and your nervous system is not functioning, you just feel bad. Brain fog, grumpiness, all the things we see, right? So you see that through yoga too. And then you come out of it, you come into a practice and maybe you're fighting with your spouse or whatever it is you have on your plate, and you walk away and you either have clarity or at least calmness.
And to me that brings it, I know we didn't talk about it in this segment, but with all these mental health issues, it fits so appropriately that even though as a chiropractor I may not have any mental health techniques or services to provide, but we can incorporate yoga as one of those basic elementary lifestyle changes that can help your brain not only reset but rest, recover, but more importantly, that flexibility and motion. We are lacking as a society. I mean, they call it the sedentary syndrome now. That is like the biggest challenge because people are just not moving.
They have a sleeping bottom syndrome now. Have you heard of this?
What is it?
Dead bottom syndrome from people sitting too long. That their bottoms are getting they don't.
Wow.
Dead bottom syndrome. You heard it on a Saturday morning. It's a thing.
It's a thing.
It's kind of an interesting moment too when we start talking about dead, okay? And we're in yoga life. But the piece is, I've sat in yoga classes and we get into that final meditative state, and I have seen many people weeping, just tears coming out of their eyes, and it's so cathartic because it's okay to let your emotions just drain through you and have people around you that are so supportive and so energetic. And that's when we talk about mental health, it is okay. And you find someone that you can be with to share yoga with would be even more beautiful. Maybe your husband and your wife team come together to do this beautiful segment together so that you can build more awareness. I have good times with my husband because he's not as flexible. I love you out there. He's not as flexible as he wants to be, but he always keeps trying. And I really reflect on that because when you give up, that's the end. That's the dead bottom syndrome. But keep trying because I think it gets better over time.
It's so funny. I tell my guy friends, when they go, they feel a little awkward because
Yeah.
they see ladies a little bit more flexible. And I always say, and they tell me, well, I don't want to keep going because I feel embarrassed. I don't want to be judged. And I said, you know, the girls there don't care whether you're that flexible or not. They really care the fact that you're there.
Yes.
And that's what's attractive to them, because many of them go pick up, you know, some relationships at a yoga class because the outfits are sexy, you got a calm environment, etc. So, but I just want to say thank you so much,
You're
Dr.
very
Crocker,
welcome. My
for
pleasure.
coming and sharing that wisdom with us. And for those of you, I want you to know that this has been a great way to kick off today. And I hope that you are as inspired as we are to try yoga in your life and maybe incorporate it into your practice. And remember, as a reminder, we have a goal of $80,000 that we're going to fundraise. And the reason for that is because we're using all of those dollars to spread positive press about chiropractic. We need more information out there to allow people to recognize that the value of chiropractic is incredibly important in today's time. It's one of the most valuable things. And I also have some great news, because last night I was bragging to my friends and we raised $14,000. Well, just guess what? Right now, up to this moment, while you were watching this segment, we're up to $17,365. So we need your help to get to our 80,000 goal. So please, if you're inspired right now, whether it's $500, $5, it doesn't matter. What matters is that you're counted, that you're part of the solution, that you feel that this is your profession and you want to help it grow. So I want you to go to our website, f4cp.org/ChiroThon. And if you go there, please go and donate. That's also the site where you can actually keep up with all the vignettes and all the information that you've been watching this weekend. So please, thank you for supporting us. We're going to be back at 10:30 a.m. Pacific time with the incredible Dr. Heidi Havoc. And you don't want to miss that, because as you know, she's become one of the top researchers in chiropractic. Not only that, she speaks your love language. You can understand her.
Yes. Come back soon.